If you struggle with burning, pain, or tingling in your feet, Front Range Medical Center's chiropractor can help. Dr. Dean Anderson shares how he can free you from peripheral neuropathy. Remind our viewers, what is peripheral neuropathy?
So peripheral neuropathy is damage to the nerves in our periphery, in our extremities. Most commonly, it'll start off in the toes or the ball of the foot. It'll work its way up towards the knees. It can affect upper extremity, so starting in the fingertips and working its way up towards the wrists, but it's damage to the peripheral nerves.
Okay, and what causes peripheral neuropathy?
You know, that one of our objectives when patients come in is to first understand why, what's driving. And the most common cause are blood sugar issues, diabetes, even pre-diabetes, but neuropathy can also be secondary to an autoimmune problem or chronic inflammatory issue patients have. Side effects of certain medications, chemo medications, statin medications, chronic use of antacids. It could be because of liver or kidney problems. So in the beginning, we always want to make sure we understand what's driving it. A lot of patients we see, they know why when they come in because they've been dealing with it.
Okay.
Other patients are told, hey, this is idiopathic, meaning there's no known cause. But for those patients, I always stress there is a reason. It's not normal to have it, right? So we just dig as much as we possibly can to figure out what's causing it.
Are there certain things that patients have been dealing with when they come to see you?
Yeah, usually with neuropathy, patients will have discomfort. So it can be numb, it can be tingling. As it progresses, you can get sharp burning pain is very common. And because of these symptoms, sleep is a real challenge for a lot of patients. The nerve pain is usually worse at night. So we have a lot of patients who struggle with sleep. Balance and mobility are big concerns. Mobility because it's very uncomfortable to be on our feet for any period of time, so it limits walks, sometimes just standing in the kitchen, being able to travel, playing with the grandkids. And then balance. You know, with lack of feeling, with numbness, we'll have a hard time knowing where our feet are, so we have a lot of patients who struggle with balance.
Okay, if peripheral neuropathy is not treated, then are there any long-term complications?
Yeah, I mean, neuropathy, it's a progressive condition, right? It typically doesn't just self-correct. It gets worse over time, and we start to have more issues with limitations, just quality of life. So the big concerns is just decreased quality of life and function over time, the balance, the fall risks, those things. So some patients worry about like amputations. I'll always bring that up, and that is a concern, but you know, it's few and far between, and I like patients to keep that out of their minds. Okay,
great.
Yeah.
And you offer an advanced treatment. So what is your approach to peripheral neuropathy?
Yeah, so first of all, Sam, when patients are usually diagnosed, the standard of care for treating neuropathy are medications, right? Gabapentin, Lyrica, which can be helpful, but it's not doing anything for the nerve damage or what's caused it. We do a treatment in our office that's electrical. Nerves are electrical. And with this advancement in treatment, we're providing something called nerve re-education. With that, we see significant reductions in the burning, sharp shooting pain. Patients who have numbness start to regain feeling. So this advancement in treatment allows us to address the nerve issues. And there's ancillary treatments we're doing to help increase circulation. And then the final component is making sure we understand what's caused it, right? The blood sugar issues, the autoimmune or inflammatory problems, and we address those issues along the way. So it's really this comprehensive approach that allows for success.
That's very great. And if you're watching right now, if you are experiencing some of these issues or symptoms that Dr. Dean has described, we want you to call him for a free consultation. The number to call is 720-881-9749. And you have many happy patients, so let's listen to one right now.
I'm exceptionally grateful to Dr. Anderson and his staff for the wonderful care. They're really amazing, wonderful, caring people, and the therapy works. Try it. If it doesn't work, you can walk away. I always guarantee it'll work for you. It works for me.
Really wonderful. And what would you say makes your office so unique?
Yeah, a couple things, Sam. Number one, this is the only condition we treat. All we treat is peripheral neuropathy. You know, I've been in practice for over 20 years. We have a ton of experience. And then the advanced treatment, the technology we use to really help with nerves and nerve re-education. And then the other component is making sure we understand what's caused it, right? It's this comprehensive approach, because if you just address nerve damage, you don't address the underlying cause, we could get patients better, but these symptoms may start to revert back. So again, it's very important to make sure we address all these components, and that's what's going to allow patients to get their lives back.
Yeah, and I do really love that you focus on nerve re-education. What is the cause? And so is that why you're seeing that your patients are getting results when before maybe they've been told that nothing could be done for them?
Yeah, and again, that just boils back to what I was saying earlier, like the standard care approach, right, to neuropathy is medications. Gabapentin, Lyrica, and it's not doing anything other than just managing symptoms. So it has its place, but the condition will progress, get worse over time, and that's where a lot of frustration sets in.
Yeah, well, thank you so much for looking out for folks here in our community. We appreciate it, Doctor.
Thanks, Sam.
And the first 12 people to call 720-881-9749 today will receive a free consultation, which is a $245 value. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. That number again is 720-881-9749 or visit denverneuropathy.com. Dr. Dean Anderson paid for today's segment. Stay right there.